Hi, I am Dr. Arsalan, and today we are going to discuss the function of nephrons, or function of kidneys, or the process of formation of urine. The first process in urine formation is ultrafiltration. Ultrafiltration is also called pressure filtration. This takes place in the glomerulus in the Bowman's capsule. Different arteriole which emerges out of the glomerulus has diameter of 50% less than afferent arteriole. Its diameter is 50% less than the afferent arteriole. This was the afferent arteriole. The afferent arteriole is the blood vessel which is innervating to the glomerulus, while efferent arteriole is leaving the glomerulus. So the leaving area, this blood vessel has diameter less than the afferent arteriole which is coming. This difference in diameter and size of blood vessel constitutes a high pressure in the glomerulus because as per Boyle's law, when the volume is decreased, the pressure is increased. So high pressure is constituted in this glomerulus. This high pressure of the blood is called hydrostatic pressure. This hydrostatic pressure is responsible for filtration of the blood due to, as you know, that there are pores in the endothelium of capillaries of glomerulus. Through these pores, due to high pressure, the blood filters out the fluid portion into the Bowman's capsule. This is called glomerular filtrate. So about 20% of the blood plasma is filtered in this way. The glomerular filtrate contains water, useful substances like enzymes, hormones, amino acid, glucose molecules, as well as it contains waste products like nitrogenous waste, harmful products, toxins, etc. So its composition, the glomerular filtrate composition is just like the blood plasma. So this fluid has been generated due to the blood pressure, the hydrostatic pressure. This is called pressure filtration or ultrafiltration. Glomerular filtrate has to cross the three layers to pass to the Bowman's capsule. The first layer is capillary endothelium. The pores in the walls of the capillaries of glomerulus are called capillary endothelium. Second layer is basement membrane of capillaries. The underlying cells in the glomerulus constitute the basement membrane of capillaries. And third, the endothelium of Bowman's capsule. This layer constitutes the endothelium. So the Bowman's capsule is also made up of endothelium, and glomerular filtrate has to cross these three layers: the capillary endothelium, the basement membrane of the capillaries, and then the endothelium of Bowman's capsule. This glomerular filtrate is then passed through the tubular section of the nephron. Next step in urine formation is selective reabsorption. Selective reabsorption means that desired substances which have been filtered through the glomerulus are returned back to the blood. So this is achieved in the renal tubules of nephron. As in the glomerular filtration, most of the blood plasma has leaked through the pores. About 125 ml per minute glomerular filtrate has been produced. This is huge amount. For example, if we convert this 1 to 25 ml into 1 hour, so multiply it by 60, and in 1 day multiply by 24. This product comes to the 180,000 milliliter, and if divided by 1000, this will give you 180 liters urine production per day. This is a huge amount and is unable to be afforded by the body. So most of the glomerular filtrate is reabsorbed from the renal tubules back to the blood. This is called selective reabsorption. Out of 125 ml per minute which was secreted, 124 ml per minute is reabsorbed. This reabsorption takes place in the renal tubules. As we have discussed, the renal tubules have three segments: the proximal converter tubule, loop of Henle, and distal converter tubule. So one by one we will discuss this portion and the reabsorption mechanism. The first segment of renal tubule is proximal converter tubule. In proximal converter tubule, about 80% of the blood plasma is returned to the blood, comprising water, energy, hormones, amino acids, enzymes, and other useful substances. All these substances are returned from the proximal converter tubule back to the blood through these peritubular capillaries. Sodium chloride is also returned from the proximal converter tubule. Second segment is loop of Henle. Loop of Henle is specialized in retention of water. When the body is in need of water or when excess amount of water is excreted in the glomerular filtrate, so the water is retained and reabsorbed through this loop of Henle. Water is reabsorbed by counter current multiplier system. This is an important mechanism. When the water retention is desired or water reabsorption is desired, the loop of Henle secretes out the sodium and chloride ions. Outside the loop of Henle into the renal medulla, these ions are secreted out actively. It means that using body energy, the loop of Henle pushes these ions out of the glomerular filtrate. When these ions are lost, the glomerular filtrate becomes diluted. Water concentration exceeds in this glomerular filtrate due to loss of ions and salts, and outside environment has less concentration of water as compared to the loop of Henle. Due to this concentration gradient generates. Inside water is higher concentration and outside water is in lower concentration. So as a general law and rule, the water will move from higher concentration towards the lower concentration. Crossing this membrane process is called osmosis. So through the process of osmosis, water will leave the loop of Henle and return back to the blood and kidneys. So this is called counter current multiplier system, in which due to the concentration gradient, water has been reabsorbed from the loop of Henle. And third segment is distal converter tubule. Distal converter tubule has channels for antidiuretic hormone. Antidiuretic hormone is secreted from the pituitary gland when the body is in dehydrated condition to retain and reabsorb the water and to produce concentrated urine. So antidiuretic hormone, when it is released, it has channels in the distal converter tubule and which respond to this antidiuretic hormone, due to which the water is reabsorbed from the distal converter tubule into the peritubular capillaries and returned back to the blood. It also maintains the pH of the blood by secretion of hydrogen ions. When the acidity of the blood increases, the hydrogen ions are secreted into the distal converter tubule, resulting in increased pH of the blood towards the normal level. Normal pH of the blood is 7.4. Third step of urine formation is tubular secretion. Tubular secretion is basically the process in which the substances which have escaped filtration in the glomerulus are returned back from the blood into the renal tubules. It is the returning of wastes, harmful substances, toxins, drugs, anything which has escaped the glomerular filtration from peritubular capillaries to the renal tubules of nephron. So the process of transferring of waste harmful materials from the peritubular capillaries to the renal tubules is called tubular secretion. Most oftenly, loop of Henle plays a vital role here, and these substances are returned to the loop of Henle of nephrons. The mechanism involved here is the osmosis, due to which the waste products from the blood are shifted into the renal tubules. So this shifting of the waste materials from the blood by peritubular capillaries into the renal tubules, especially loop of Henle, is called tubular secretion. This was the mechanism of formation of urine. In this way, the glomerular filtrate here in the distal converter tubule, after the mechanisms of reabsorption and secretion, become urine, which is drained to the common collecting duct, which contains different nephrons opening into it. The urine is then passed from this common collecting duct to the renal pelvis, and from where the ureters take away this urine to the urinary bladder, and then it is excreted out of the body through urethra. So this was the formation of urine.